Hi everyone, so the service that we chose to do is wraparound services for the undocumented Latinx community. First, I'm going to be touching on the learning objectives for our project, which the first one is understanding wraparound services, which wraparound services are individualized support systems designed to address the multi-phase needs of a vulnerable population. They are particularly crucial for undocumented individuals and families who face unique challenges such as legal, healthcare, and educational barriers. The next objective is exploring the components of wraparound services, which includes comprehensive support, cultural responsiveness, and individualized approaches tailored to the unique circumstances of undocumented populations. The last one is the effective outreach strategies, which are crucial for promoting access to wraparound services among undocumented populations. This includes cultural competent outreach, building trusted community partnerships, and ensuring information and services are accessible in multiple languages to reach a diverse population. Hi everyone. So we opted for Promoter X approach in delivering wraparound services because of its community-centered philosophy. Promoter X engages trusted community members known as promoters who possess an intimate understanding of the cultural intricacies and challenges experienced by undocumented individuals and families. These promoters are culturally competent, adept at bridging linguistic and cultural barriers to ensure our services are accessible and tailored to the needs of our diverse clientele. Through their expertise, establishing trust and rapport within the community, facilitating meaningful connections, and building relationships of trust with undocumented individuals. By leveraging these existing bonds, Promoter X promoters create a supportive and inclusive environment where clients feel understood and empowered. This approach not only enhances the effectiveness of our services, but also fosters a sense of belonging and dignity among undocumented individuals and families. So,
Two key resources for our project that we utilized are as followed: Accessing Mental Health in the Shadows, published by the California Pan-Ethnic Health Network report. We also utilize We Need Health for All, Mental Health and Barriers to Care Among Latinx in California and Connecticut, published by Espinosa, Kulik, and Cerdeña. So the first article, Accessing Mental Health in the Shadows, emphasized barriers to accessing mental health care for immigrants in California. And although there have been expansions in public mental health services, undocumented adults remain excluded from most health care coverage options. This report also emphasizes the pressing need for improved access to mental health services for immigrant communities who are locked out of Medi-Cal benefits. Medi-Cal plays a crucial role in providing mental health services to immigrants in California, yet gaps in coverage persist, leaving many vulnerable individuals without essential care. The next article, We Need Health for All, Mental Health and Barriers to Care Among Latinx in California and Connecticut, explores the difficulties encountered by underserved Latinx immigrant groups in accessing mental health resources. It highlights factors such as migration trauma, discrimination, and structural vulnerability. The article proposes a comprehensive model for providing mental health services, including language access, structural competency, expanded health insurance, and resources for community health workers. These findings align with the goal of our project. Both of these articles actually align with the goal of our project, which is to provide culturally sensitive wraparound services for undocumented Latinx communities. Key insights for undocumented Latinx community. Number one, culturally competent services. It is essential to offer culturally sensitive mental health services that accommodate the specific needs of undocumented Latinx individuals to effectively meet their mental health needs. Overcoming barriers, recognizing that addressing barriers such as language barriers, fear of deportation, and the stigma surrounding mental health within the Latinx community is essential for increasing access to mental health services and support. Community engagement, engaging trusted community members such as promotores, and establishing lasting partnerships with community-based organizations is crucial for expanding outreach and enhancing the effectiveness of wraparound services.
Hi everyone, today I will be discussing how we plan to recruit participants. The first step that we plan to do is to familiarize ourselves with the community and any local organizations that provide a variety of services. We specifically want to form relationships with organizations um, that our target clientele seems to be interacting with more or seems to seek out, just so that we can kind of build that relationship with the community and get our name out and be able to advertise in some ways the services that we are also offering. We also plan to partner with community leaders to learn about the needs of the community. That way we can tailor our services to what is most needed by the community members. Um, the other step in recruiting participants is to attend local events to share information. So this includes going to any local churches, to supermarkets, any activities or events that are happening within the community, as well as even starting relationships with local schools so that we can advertise our services to parents that are there. And as well as to the children so that we can kind of do that wraparound services for the entire family. And then lastly, we want to promote our services throughout the community, and by ensuring that our marketing materials are accessible. So that includes having them in English and Spanish and any other needed languages or dialects of community members um, that we can serve, because it is targeted towards undocumented Latinx community members, but we can also extend our services um, to all undocumented folks, so that way we can be being as inclusive as possible.